Let's see what is water breaking during pregnancy, also known as PROM. The pregnant women are well familiar with the term the water bag. Inside the uterus, there is a membranous sac known as amniotic sac around the baby filled with a fluid called amniotic fluid. This water bag not only cushions the baby but provides room for the baby's movements. Ideally, these membranes rupture at the beginning of labor or during labor, and this process is known as water breaking. However, if water breaks before labor, it's known as PROM, pre-labor rupture of membranes, previously known as premature rupture of membranes. Pregnant women should know the signs and symptoms of water breaking. Except in ideal conditions of water breaking, followed by a gush of fluid running down, it's not evident in all cases of mild to moderate rupture of membranes. In these cases, amniotic liquid may be confused with urine incontinence, which is not that uncommon in the last trimester of pregnancy. The doctor will do a confirmation after physical examination, as leaking is more consistent of clear or pale yellow color with no odor, unlike urine with ammonia-like odor. Ultrasound. It may be helpful to check amniotic fluid levels. One should know what are the consequences of water breaking. Typically, if water breaks at term, it is followed by labor soon, if already it has not been started. In the case of rupture of membranes before labor, there are two situations. At term, after 37 weeks of pregnancy from where the term starts, if the water bag ruptures before the onset of labor, the doctor might stimulate the uterine contractions with medicines. As the baby is getting devoid of an amniotic fluid, which is an essential source of nutrition, hormones, and antibodies to the baby, the risk factors of water breaking are there if labor is delayed. The longer it takes to start labor after water breaking, the greater the risk of getting an infection of mother or baby. Before term. If water breaks before 37 weeks of pregnancy, it is known as the preterm pre-labor rupture of membranes or preterm PROM. Certain risk factors increase their chance, such as inflammation of fetal membranes due to maternal or fetal infections, previous history of preterm PROM, vaginal bleeding during the second and third trimester due to abruption of the placenta, when the placenta separates from the uterine wall, poor nutrition and underweight mothers. The membranes in this case do not get enough collagen fiber, which is a protein, to gain enough strength. Smoking and use of addictive drugs. Short cervical length. In such cases, the cervix opens before labor, and a part of fluid-filled membranes may protrude through it, so they get ruptured easily before term. Now the question arises how to manage this pre-labor rupture of membranes, whether it occurs before term or after. Pre-labor rupture of membranes puts fetal safety at stake. However, management varies depending on the duration of pregnancy. At 34 weeks, if pregnancy has reached at least 34 weeks, the fetal lungs are mature enough to survive in the outer world. If there are signs of infection, delivery might be induced either vaginally or through cesarean section. However, if there are no signs of disease or fetal health problems, pregnancy can be continued with the vigilant watch. Between 24 to 34 weeks. At this stage, the baby is not mature enough to survive after delivery. So, every possible effort is being made to continue the pregnancy. Like antibiotics are given to prevent fetal and maternal infection. An injection of corticosteroid is given to the mother to improve fetal lung maturity. And at 32 weeks of pregnancy, if the labor and delivery of the baby are inevitable, an injection of magnesium sulfate is also given to mother to protect the baby's nervous system. Corticosteroids may also be given to mothers anytime after 23 weeks if there is a risk of delivering within next 7 days. Thanks for watching. Please like, subscribe and share. Stay safe and sane. Science will win.